So we are live. Hello everyone and welcome to another session of the Sunstar Conversations, a recurring series of interviews with renowned speakers about a broad variety of topics. So today we will be discussing smoking and how it affects your oral health. And I'm joined by Professor Nurcan Buduneli, who is Professor of Periodontology at the Ege University in Izmir, Turkey. So a warm welcome to you, Nurcan. How are you doing today?
Thank you, Martin. I'm very fine and I'm happy to be with you. Thank you for this kind invitation for this interview.
You're welcome. Now, before we start, I want to say to everyone who's watching that if you have any questions, feel free to ask them in the Q&A. If you're watching on Zoom or if you're watching on Facebook, you can simply ask them in the comments below. So, as I mentioned, we will be talking about what smoking does to your oral health. But I want to start with more setting the scene for today, because I think we agree that everybody knows that smoking is bad for you. So you would expect that it's not so much of an issue anymore these days. Or am I being a bit too optimistic now? Are people even still smoking, Nurcan?
Yeah, I completely agree with you that it is very well established and very well known that tobacco products are very, very harmful to our general health as well as our oral health. But still, many people are continuing to smoke, and even worse, the prevalence of smoking among youngsters, among adolescents or teenagers are increasing dramatically, and this is really kind of disappointing after all these information and all these evidences showing the close relationship between tobacco products and many cancers, for instance. But it is still a fact.
And what could be the reason that young people are starting smoking more and more? You know, I assume there's a tendency that people are smoking less and less, but why is this particular group increasing?
Yeah, I think one point is to be socialized because youngsters particularly want to be a member of a social group. And if people among the social group are smoking or are vaping, then the others who are tobacco free until that point are ready to start. And it is established and it is stated that young people are more eager to experiment on using different types of things. And among these, one of them is the e-cigarettes and also the shisha, the water pipe. They are particularly becoming more trendy among youngsters.
Ah, okay, yeah, that's interesting. Yeah, you mentioned already the water pipes, the shishas, and the vaping. Are there any other uses of tobacco that we know and that could also be harmful for your health and your oral health?
Yes, sure. We all know about the conventional cigarettes, but apart from the cigarettes, there are snuff and the chewing tobacco, and then the smokeless, they are the smokeless tobacco products, the snuff and chewing tobacco leaves. And then, you know, this e-cigarettes and water pipe or shisha or hookah, it has different names, but it is actually the same thing. And one major thing to emphasize is all these tobacco products contain nicotine. So none of them is free of nicotine. So none of them can be harmless. None of them can be an alternative to the other one. I mean, all of them are hazardous to our health.
And nicotine is the ingredient that makes this tobacco addictive, isn't that right?
Yes, it is the major addictive component, and it is not only addictive, but it is also cytotoxic, and it can be also carcinogenic. But it has been shown that in tobacco smoke, there are more than 7,000 different chemicals and at least 70 chemicals which are known to be carcinogenic.
Wow, that's amazing.
Yeah.
Amazing. So you mentioned the snuff, was it, and the chewing tobacco? Here in this region of the world, we don't really know the chewing tobacco, not anymore at least. I know that they use it many decades ago. apparently there are regions in the world where this is still being used very frequently. So can we also maybe conclude that there's also a sort of a cultural aspect in the whole
Yes.
story around smoking?
Yes, yes, sure, you're right. It's a good point. And snuff can be more common, or at least was more common in Nordic countries like Sweden, for instance. And chewing tobacco is more common in Far East, and water pipe actually comes from the Middle East. But surprisingly enough, it is becoming more and more popular in the Central Europe, like in Belgium, like also in the United States of America. It's becoming more and more trendy and common amongst.
Yeah. Interesting. So when you're talking about smoking in general, or maybe even tobacco use in general, what are the implications for oral health? We all know that it's bad for you and that it can cause, for example, lung cancer. I think most people are, aware of this. What can it do for your oral health?
Yes. Most people are aware of the harmful effects of smoking and its relationship with lung cancer, as you already mentioned. But it is also very closely related with the oral health and oral cancer. And oral cancer is the 6th most prevalent cancer globally, and smoking tobacco products is among the most important risk factors for oral cancer. But tobacco products have many influences, negative influences on our oral health. Actually, it was first demonstrated 70 years ago by Pinborg that tobacco was closely related with necrotizing ulcerative gingivitis. And during these 70 years, so many clinical and biochemical and microbiological studies have been performed documenting the harmful effects. And today we know that smoking increases the risk of developing periodontitis and also the severity of periodontitis. So it increases the risk of losing tooth, and also it affects negatively the outcome to periodontal treatment, to non-surgical periodontal treatment or surgical periodontal treatment, and for instance to the root coverage surgeries. The outcomes are affected badly from smoking, and root coverage is usually required for aesthetic purposes. So smokers are in a disadvantage from this point of view.
Okay, so it can do pretty. It's pretty harmful for the gums. So when you talk in figures, how big is the problem of what is the risk of smoking for periodontal disease?
Well, smoking is, first of all, still very common globally, and it was 5 years ago when WHO estimated that by year 2020, which we are living right now, 10% of deaths globally will be related with tobacco products. So it is very, very important. And it is still very common in many countries. And it increases the risk of developing periodontitis by to 8 times.
Wow.
So the risk of attachment loss increases 4 to 8 times in smokers compared to non-smokers. Smoker individuals have more recession, more deep pockets, and the risk for tooth loss increases 5 times in smokers. And actually we can relate half of all periodontitis cases with smoking. Half of all periodontitis cases, which is really tremendous.
That's huge.
Relationship. Yeah, it's huge. and it masks the inflammation signs in the oral cavity, and this makes people unaware of the periodontal disease or gum disease they already have, so they don't need to seek treatment, and which is bad, of course, for the outcomes.
Oh, that's really interesting.
Yeah.
So you're saying that patients with periodontitis, gum disease who smoke, they might not even be aware that they are having inflammation of the gums because the smoking sort of limits the symptoms or the signs, the bleeding and the swelling. Wow. Okay.
Exactly. Yes. And we can observe further periodontal breakdown and further clinical attachment loss during the supportive periodontal treatment phase in smoker periodontitis patients. And also dental implants have a worse prognosis in smokers compared to the non-smokers. So the failure rates are more. There is more bone loss. There is more risk for post-operative infections in smokers who receive dental implants.
Okay. So if I'm hearing this and listing all these facts, it sounds like smoking is the biggest challenge to a dental professional there is at the moment.
Yeah, exactly. You're right. And it is regarded as the most important environmental risk factor for periodontal diseases. And this is now shown in the new classification system for periodontal diseases, because now it is directly included in the classification system of periodontitis. So it affects the grading of periodontitis. And therefore, I think it is good to have this effect in the classification, because it makes us as dental professions and also as patients to focus more on this relationship. And there is also a dose-response relationship, which is likely in many, many aspects. So therefore, it is very important to ask our patients whether the patient is smoking and how many cigarettes or which tobacco products is the patient using. And also we can help as dental care providers, we can help our patients to quit using the products.
Now, you already mentioned the dose-response relationship. So the more you smoke, the bigger the problem. Is there also such a problem of being a past smoker, or maybe even a passive smoker? So not that you are smoking yourself, but you're, smoking with others?
Yes, exactly. Well, ex-smokers are, of course, in a better position compared to the current smokers, but not as good as never smokers. So the best thing is never start using any tobacco product. So we should recommend our friends, our patients, to everybody that we can reach to stay tobacco-free if they are not using any tobacco products. But of course, we can help our patients in counseling them to quit smoking, and then the signs and symptoms and the prognosis will get better.
Yeah, this is related to
any oral disease problem.
Okay, yeah. I think this is related to one of the questions being asked in the Q&A, because somebody's asking, how much time does it take for teeth and the mouth to become normal again from the moment you stop smoking? Or are some of the issues maybe even irreversible?
Well, actually, we see staining on teeth, and we also see discoloration on gingiva due to the hypermelanin production by the melanocytes. And these are, of course, not good for having a socially acceptable smile. And it is not good to have also a fresh breath. So these aspects are important for our social relationship as well. And after quitting, first of all, we can state someone as an ex-smoker if the person hasn't been using any tobacco product for at least 1 year. So the time limit is 1 year to stay tobacco free for 1 year. And after this 1 year, of course, many or almost all of the signs and symptoms in the oral cavity will subside significantly.
Yeah.
And of course, we can help our patients to have a more aesthetic smile after they quit. We can help with the discoloration in the gums, and of course we can help with the stainings on the teeth. They are no more, they will not be a problem for ex-smokers.
Okay, so they are reversible. Yeah.
Yeah, reversible. Yeah.
Okay. We have another question coming in from Facebook. Does vaping has the same impact on as smoking on the gums and on gum disease? Is there any data or research available?
Yeah, well, actually, we are in the infancy on the research of vaping, the relationship between vaping and oral health. I would say we are still in the infancy, and we need many more data to be sure about the effects. But we can say that already that vaping is as harmful as smoking in terms of increasing the severity and prevalence of periodontal diseases and also oral cancers. There are limited data, but the data available already indicates a relationship between vaping and oral health. And this is actually mainly related with the chemical ingredients, as I have already mentioned, but also the tremendous heat that occurs during vaping and smoking. And it has been shown that during vaping, the temperature in the oral cavity reaches really, really high degrees, which makes heavy metals to be absorbed by the oral tissues, which is a risk factor for cancer development in the oral cavity.
I think that's quite shocking because many people see vaping as sort of the healthy alternative to smoking. But when I hear your story, that's not really the case.
No, this is actually the marketing policy. The companies they claim that vaping is a healthy alternative to smoking, but it is not. It has the e-cigarettes have nicotine, and they have flavoring components to make more and more people addicted to tobacco products. So it is not safe at all.
No. So you already mentioned also the beneficial effects of smoking cessation on oral health, but also on treatment outcomes. So yeah, you can frame this as sort of a role of the dental professional as maybe also a lifestyle coach for a patient to stop smoking. Yeah. Maybe do you have any tips and tricks for clinicians or people in the field working as a dental professional, how they can support patients stopping the smoking?
Yeah, well, first of all, being non-smokers or never smokers, we should understand a smoker individual that the smoker individual is really chemically addicted to the tobacco products. So it is a fact, and it is not that easy to get rid of it. And actually, many smokers we face in our clinics have already attempted to quit smoking, but may not succeeded yet, at least. But we can help them. How we can help them? First of all, we can help them to understand the negative effects of smoking in the oral cavity, and that they may lose their teeth in a premature period in a near future, and then they will of course face many more problems. And after quitting, they will get back their healthy oral tissues, healthy teeth and gums in a short while. And it has been shown in literature that brief and repeated counseling is more effective in helping smokers to quit. And we are, as dental professions, we need to have good communication with our patients to be successful in each and every treatment that we provide to our patients. And good communication is a key point and we already have it. So it is kind of an advantageous point for the dental care providers to help their patients to quit. And then many dental interventions need multiple visits and frequent visits, which also makes it easier to counsel our patients in quitting using tobacco products.
Yeah, I see especially the advantage of the dental office is that compared to, for example, the general physician, you only go there when you have a problem. And for the dentist, I think it should be a regular visit. So you visit the dentist once or twice a year. So you have these recurring visits, and then from you can keep on motivating the patient every time to stop smoking if necessary.
Yes, exactly. Yes.
Yeah, really nice. So in one of our previous interviews, we talked about quality of life, which is a really interesting topic, I think.
Yes.
Is there any data on how smoking can affect quality of life and also oral health related quality of life?
Yes, well, smoking has very significant negative influences on our general health. It decreases the sleep quality, for instance. It decreases the physical capacity of the individuals, and people may get may get tired easier if they are smokers, and therefore smoking decreases the life quality in general, and also the taste. It is very important to get the taste while we are eating or drinking, and smoking decreases the taste, the joy of eating or drinking. And therefore it is an important loss, I would say. So therefore actually using tobacco products is a part of poor lifestyle.
Now that you mentioned this, I remember talking to somebody who just stopped smoking, and always the first thing people say is, I didn't know this smelled or tasted this good while I was smoking. So I think that's a really interesting also benefit of stopping with smoking, is that you are really able to enjoy the good things in life.
Yes, exactly. As long as, of course, we can place something in the place of tobacco, I mean, in terms of addiction. And this can be doing sport, for instance, regularly, or having a hobby or something, because if we cannot replace the place of tobacco addiction, then the quitting may not be a long-term reality.
Talking about this, you also always hear that you stay an addict for the rest of your life. Even if you stop for 10, 20, or even 30 years. Are there some tips or tricks also for people to remain a non-smoker, to continuously not smoke?
Yeah, well, psychologically, it is important to know the reasons or the triggers that make someone smoke. And this is, of course, a personal thing. It varies from person to person. So it is the duty of the person himself and also a healthcare provider to find it out. What are the reasons of smoking? And then it will be easier to replace something else and get rid of smoking. So that is one major thing, to find the reasons of smoking.
One other question that we always ask in this series is the fact that we're living in a rather special time. With current crisis, people experiencing a huge amount of stress because maybe they are staying at home, losing their job. You can name whatever reason, losing maybe relatives or friends. Do you think the current situation might have also impacted smoking behavior, and then, of course, subsequently, the negative effects on oral health?
Actually, yes, it is a kind of unlucky period that we are living right now because of this pandemic, and it is more stressful for many of us compared to the period before this pandemic. And of course, the higher the stress in one's life, the person may need to smoke more. I mean, it may easily become a triggering or stimulating factor to smoke, but we should be aware of this reality, and we should, of course, try to stay tobacco free. And the healthcare providers are ready to help for those.
Yes. So we are reaching the end of our interview. I'm checking the chat box, and there's one question in the beginning that asks, the cultural aspect is very interesting. Was there maybe a study performed that shows the correlation between local smoking habits and the oral health of people? So maybe that we see a higher prevalence of oral diseases in certain parts of the world?
Well, I think we cannot say that, because it depends on the individuals participating in a particular study, and but we know, and we can say globally, there is a dose-response relationship between smoking and oral diseases, including periodontitis, tooth caries, and oral cancer. So I wouldn't say a particular region in a world, but rather a population of smokers.
Okay. Yeah. Then maybe as a final question, I assume you are still heavily involved in doing research into smoking behavior and oral health. What are your future plans on this? Are there any interesting research projects going on? Do you plan on interesting projects for the future?
Yes, actually, we have held an international conference on negative effects of smoking 2 years ago in Izmir, where I am living in Turkey, and we have already performed some surveys in our students, actually in dental school students from different universities in Turkey, and also in our patients. And I think we should be determined in keeping our interest in helping our patients to quit, and we should continue there will be more studies related with vaping, I would say, as it is a rather new product on the market. But it is clear enough to say that it is harmful.
Okay. I think we lost the connections a few times, but anyway, we also reached the end of this conversation. So again, it was a really pleasure to talk to you. I think you gave a lot of very interesting insights, and I hope all the viewers have learned a lot by listening to this. Everybody who has watched, thank you. Also, thank you for putting in your questions. I think there were some really interesting ones. So I think we can leave it at that. We will upload these conversations on YouTube afterwards, and they will also remain on Facebook. So if you missed some parts, or if you want to share with your colleagues or friends, you can go ahead and watch them back at a later stage. So thanks again, everybody who's watching. Thanks, Nurcan, for your contribution, and we will see you in 2 weeks.
Thank you, Martin. Thank you. Bye-bye.
Bye-bye.
Bye.